When people think about medical breakthroughs, they picture new drugs, complex surgeries, or futuristic machines in operating rooms. But one of the biggest revolutions in healthcare isn't loud, flashy, or even visible. It's happening quietly, in the background, inside algorithms, data systems, and artificial intelligence models that are reshaping medicine from the inside out. This is the story of AI in healthcare, the silent revolution. For decades, diagnosing illness has depended on human experience, long hours, and sometimes educated guesswork. Today, AI is learning to recognize disease patterns faster than any doctor ever could. From analyzing X-rays and MRIs to detecting tiny irregularities in blood tests, AI systems can spot early signs of cancer, heart disease, neurological disorders, and eye conditions with astonishing accuracy. These models don't get tired. They don't rush. They review thousands of cases in seconds and compare them against millions of historical records. The result? Faster diagnoses, fewer mistakes, and earlier treatment, often before symptoms become serious. Traditional healthcare has always relied on averages, average doses, average responses, average risk factors, but no two bodies are the same. AI changes this completely. By analyzing genetics, lifestyle data, medical history, and real-time monitoring, AI can design personalized treatment plans for individual patients. One person's cancer therapy, diabetes management, or heart disease prevention plan no longer has to match the population. It matches the person. Medicine is shifting from one-size-fits-all to one-size-fits-you. One of the most powerful abilities of AI is prediction. By studying patterns across millions of health records, AI can identify warning signs long before a disease fully develops. It can flag patients at high risk of stroke, heart failure, infection, or mental health decline, sometimes months in advance. Doctors no longer just react to illness, they anticipate it. And in healthcare, prevention is often the difference between life and death. In operating rooms, AI isn't replacing surgeons, it's enhancing them. AI-assisted surgical systems guide doctors with real-time data, steady movements, and millimeter-level accuracy. This leads to smaller incisions, fewer complications, faster recovery times, and better outcomes. AI can also analyze surgical videos to help doctors refine techniques, identify mistakes, and improve future procedures. Surgery is becoming not just an art, but a science backed by data. In hospitals, nurses juggle countless tasks, monitoring vitals, responding to alarms, documenting care. AI systems are now acting as silent assistants. They track patient data in real time, detect dangerous changes instantly, and alert staff before emergencies occur. Whether it's a sudden drop in oxygen, abnormal heart rhythm, or signs of infection, AI never blinks. This allows human caregivers to focus on empathy, comfort, and decision-making, while AI handles surveillance. Doctors are drowning in paperwork, reports, charts, billing codes, documentation. It steals time from patients. AI automates administrative tasks, transcribes notes, fills records, schedules appointments, and manages workflows. This reduces burnout, improves efficiency, and most importantly, gives doctors their time back. Fewer tired doctors means fewer mistakes. And in medicine, even a small error can cost a life. In rural areas and developing countries, doctors are scarce. AI changes access completely. Smart diagnostic tools can be deployed anywhere. A phone camera can detect eye disease. A chatbot can triage symptoms. A remote AI system can analyze test results from thousands of miles away. Healthcare is no longer confined to hospitals. It travels with the patient. Of course, this revolution raises questions. Who owns medical data? How do we protect privacy? Can machines be trusted with life or death decisions? AI must never replace compassion, ethics, or accountability. It is a tool, not a replacement for humanity. The goal is not automation, it is augmentation. The biggest changes in history are often the quietest. AI in healthcare isn't making headlines every day, but it's saving lives, minute by minute, pattern by pattern, prediction by prediction. It is reshaping diagnosis, treatment, surgery, prevention, and access to care. This isn't the future of medicine, it's the present. And while the revolution may be silent, its impact will echo for generations.